Now, the Australian state of Victoria is continuing to struggle with a surge in COVID-19 infections. Despite Melbourne being 1 week into a renewed lockdown, the state has reported 317 new cases. Now, that's the highest single-day tally to date for any state in Australia. ABC Australia's Richard Willingham with this report.
From cancer ward to COVID contingency, the old Peter MacCallum Hospital has been transformed, ready to take up to 84 non-COVID patients from overwhelmed Melbourne hospitals. Across town at the Monash Children's, training to properly remove PPE is hands-on.
We are ready, but I don't have a crystal ball. I don't know how this pandemic will pan out.
The number of Victorians in hospital with coronavirus has climbed to 109, with 29 of them in intensive care. But it's not enough time to trigger stage 4 restrictions. That's because the effects of the lockdown haven't had time to flow through.
An out-of-control outbreak is one where no matter what you're doing, you're seeing a really significant exponential increase. We're seeing an increase, but it's relatively slow.
The next few days of data will be critical, and there's a stark warning for those who might underestimate the threat.
And so the idea that 29 deaths is nothing, and that we can lift all restrictions and that we can let it run is absurd, because it's an exponential growth in cases when there aren't restrictions in place.
On the front line, health workers continue to get sick. The latest figures show 150 people have the virus. Even more are in isolation. And ahead of a predicted surge in admissions, the government has suspended some elective surgeries to boost capacity, while the spectre of the virus hangs over those on the front line.
The stress is there, the stress is real. We've got to find those breaks and we've got to have that self-care, because if we don't, then our performance deteriorates. And I know that every single doctor and nurse and healthcare worker wants to give their best. They're proud to do this.
Answers about the cause of the clusters have not been forthcoming for the opposition, with an entire 13-page Freedom of Information document about the Cedar Meats outbreak completely redacted.
It just goes to the extent of the secrecy. This is absolutely ridiculous.
Aged care centres are another big headache, with dozens of residents and staff infected. The centres are now the target of a testing blitz designed to stop the further spread of this virus into vulnerable communities.